Over 10 million people of all ages live with arthritis in the UK. That's 1 in 6 who live with the pain, fatigue and disability the condition can cause. To mark this year's World Arthritis Day, ITN Business has teamed up with Versus Arthritis to understand more about joint health. Well, I'm joined by Deborah Alsina, Chief Executive of Versus Arthritis, the UK's largest charity dedicated to supporting people with arthritis. Deborah, thank you so much for joining us. For such a common condition, there are still many misconceptions, aren't there, surrounding arthritis?
Absolutely, there really are. And I think one of the most important ones that we need to debunk is that arthritis is not just an inevitable part of growing older, and nor is it simply wear and tear. In fact, arthritis is made up of many different conditions, all of which are very active and complicated, and just worth breaking those down into kind of 3 core groups. So you have osteoarthritis, which is the most common. In osteoarthritis, what happens is that the body stops being able to repair and maintain the cartilage, those kind of shock absorbers within the joints. And then you have another group of autoimmune inflammatory forms of arthritis. So the most common are rheumatoid arthritis, which affects about 450,000 people. And psoriatic arthritis is another, which affects about 190,000 people. And then the final one that's just worth mentioning is gout. And this is a very common and extremely painful form of arthritis where crystals build up within the joints and the immune system wants to clear them out of the way, so attacks them. So that's one of the main misconceptions, but there are others. Arthritis doesn't just affect older people. In fact, whilst it becomes more common as we grow older, it can affect you at any age. So, for example, I've met many people who were diagnosed with a form called juvenile idiopathic arthritis when they were babies and toddlers. And for many of those people, this becomes a lifelong condition that they need to manage. You hear people say, it's just a touch of arthritis. It's not very serious. It's more than just the pain that it causes. It's about the impact it has on your life, your loss of mobility, your inability to go out, to socialise, for some to work. And that can have a really poor impact on people's mental health, on their sense of self, their independence, and that's what we have to change.
As you just said there, arthritis can place a heavy burden emotionally, physically, but also financially. The UK-wide long waiting list for treatment can only be making that worse, really, for people.
Absolutely. So we know, don't we, that there are about 7.5 million people currently stuck on NHS waiting lists. And one area of great concern to us at Versus Arthritis is people who are stuck in waits for orthopaedic or trauma surgeries, for elective surgery, for a hip or knee replacement. And one of the things, again, it links back to those misconceptions, is the understanding of what elective means. It almost implies that people have choice. But I can promise you that by the time people are on those waiting lists, the choice is gone. You've gone through all the treatments you can and you have very advanced disease that will be impacting your life. You will be living in daily pain. You will be less able to work if you're of working age. It will be impacting your sense of self and your independence. So we know already that around 20% less of people with arthritis are actually able to work. And so it's a double downing of that kind of impact of poverty and financial hardship that people have already been facing.
As you touched on there, it's not a level playing field, is it?
No.
That said, to what extent do inequalities affect the outcomes?
So the first thing is what we know is that arthritis can affect anybody at any age, but actually it does affect some groups more. If you are poor or in the margins of poverty, you are more likely to be diagnosed with arthritis or another musculoskeletal condition 10 to 15 years earlier than if you are affluent. And as well as that, you're more likely to be living with one or more long-term conditions. And that's really important because arthritis is very significant in its own right. And we've talked about the impact that it has on people's lives. But then if you're living with arthritis and cancer, diabetes, heart disease, stroke. Actually, the combination of those factors make the outcomes harder to achieve, those positive outcomes that we want for people.
And with that said, what needs to be done? So you're campaigning there. What needs to change to make those improvements?
Well, it's a bit where we started, Sangeeta. So the first thing is we just need to change the awareness of the disease and the impact it has. It needs to be mainstreamed. And there's been some positive steps in that direction recently, but it requires greater investment in the diagnosis, treatment and care of arthritis. As well as that, I think what's really important is there needs to be more funding and research. We fund research. We funded over £500 million of research, which is having significant breakthroughs. It's led, for example, to exciting new treatments that have transformed outcomes for people with rheumatoid arthritis, but we need more of that. What's, I think, most concerning is that given that arthritis and musculoskeletal conditions are one of the greatest causes of disability, less than 4% of research funding currently goes into those conditions. And we need to see that change. We need to be ensuring that there are appropriate treatments available for everyone living with it. But even more importantly, we need to be reaching to be able to prevent more conditions, and for those where it can't be prevented, to more cures in the future.
And are you hopeful that, with the campaigns and raising awareness, that actually more can be done and things will change?
Absolutely. It is changing. We're seeing it changing. I just want it to go faster. People are living with this now today. The people that I speak to every day are sometimes just really struggling. Chronic pain or acute pain is really difficult to bear. Just how do you live like that? So that's why we're investing in research, we're providing services, we're campaigning for the change that people with arthritis need for a future that is free from arthritis, but until then, so that they can live well with the condition.
OK, Deborah Alsina, thank you so much for coming in and joining us today.
Thank you so much.
The health and well-being of people living with arthritis and their ability to stay active and independent is at the heart of the work Versus Arthritis does. For people whose joints have deteriorated to such an extent, joint replacement is often the only option. With long NHS waiting lists, it's more important than ever to keep patients fit and healthy ahead of their operation. Versus Arthritis have developed a new surgery toolkit to help support patients before and after surgery.
I'm 100% uncomfortable all of the time.
Mel's long experience with arthritis began when she was just 4 years old.
There's so much going on and my body's trying to process so much.
She bears the burdens and the scars of a lifetime living with a chronic, debilitating disease and the medical efforts to make things better for her. 22 procedures and counting.
I've had joint replacements to my knuckles, I've had a hip replacement, I've had wrist fusions, I've had trigger finger where they've released the tendons that have been trapped. I've got fused toes, I've had my big toe realigned.
You're waiting for a new knee at the moment, right? So
I am indeed.
What difference will that make to your life?
Freedom. It will hopefully relieve my thinking about what I need to do for every step I take. It will make me more stable for walking, just for doing the stairs, for going out, enjoying longer walks.
How would you approach something fairly simple, something that I would take for granted, like picking up a glass of water? How would it be different for you?
First of all, I've got to think about how I'm going to stand up. Are my knees going to be able to support me when I stand up? So that's the first thing. When I stand up, am I strong enough to take a step? Then I'd think about picking the glass up. Then I've got to think about which hand I'm going to pick it up with, because my hands aren't great. And if I drop a glass, that's mess. I've got to bend over and clean it up. But then I've also got to carry that across to the kitchen. Like
Mel, everyone with arthritis can access support from Versus Arthritis. The charity wants to help everyone with the condition stay active, independent and living well. Mel, for instance, has been using the exercises from the Let's Move for Surgery programme to prepare for her surgery.
So, following what the video says, just feet gently apart, holding onto the chair, and just gently down and back up.
Good.
But this is something I do in front of the laptop and the monitor, just to be able to keep working, but also keep moving.
Physiotherapist Larry Koyama helps people with different types of arthritis every day. He says movement is a fundamental component in arthritis treatment.
I would say exercise is a really important part of a range of factors to manage osteoarthritis. Healthy diet, weight management for those with more inflammatory conditions, making sure they've got the right disease-modifying drugs and medications. All of that in combination can absolutely improve or maintain the health of the joint longer. But I think it's also important to recognise that things like joint replacements and surgery have a really important role for people that need it, and it's not about preventing them from accessing that. It's more about making sure that if they need that, they get it at the right time.
And yet, so many people aren't getting the medical attention at the right time. UK-wide NHS waiting lists mean that many people living with arthritis are facing an agonising and worrying wait for diagnosis, treatment and surgery. It's currently estimated that 1 million people across the UK are waiting for trauma and orthopaedic treatments, which includes joint replacement surgery.
You can go up onto your fingertips and then maybe...
It's one of the reasons why Versus Arthritis is such a vital service. The charity's Let's Move for Surgery toolkit and exercise programme, as well as knowledge, support and advice, are essential for people's continued health and well-being.
Waiting during that time is really, really debilitating on people, and often people find that their level of health and their ability to go about their daily lives really deteriorates quite significantly because the pain is so severe.
Tell me about the Let's Move campaign. What's it all about?
Let's Move is all about looking after the bodies. So the stronger the muscles are around those joints, actually the less pain that joint will be in.
Versus Arthritis also has a surgery toolkit. What is that?
The one thing that we want to enable people to do is to recover from surgery as quickly as possible. So not only is it helpful whilst you're waiting during those longer periods, but also it aids in your recovery as well. So we created a whole host of Let's Move with surgery videos that are on the NHS website.
Arthritis is a set of symptoms with different causes and manifestations. In Mel's long journey since she was diagnosed with juvenile idiopathic arthritis, she's seen new drugs and new treatments. She's passionate about raising awareness.
This disease is very much a hidden disability. You don't have to be in a wheelchair. It's not what it says on the tin. It comes in all shapes and sizes, and everybody's journey will be different.
Driving everything Versus Arthritis does is looking after people like Mel and the health and well-being of everyone living with arthritis.
Conditions such as osteoarthritis and osteoporosis are often seen as a natural part of the ageing process, meaning many people are suffering in silence, unaware that help could be available. Researchers at Keele University are collaborating closely with patients and the NHS to test treatments, improve care and provide better outcomes.
Hello, can I help you?
I was looking for some information on osteoarthritis.
Oh, let's have a look, see what we can find.
If you've been diagnosed with osteoarthritis, you're bound to have questions.
Would
Yes,
that help?
that's lovely, yeah.
But where do you find straightforward answers?
So thanks everyone for coming to the meeting today.
Here at Keele University, patients, researchers and healthcare professionals are working as one multidisciplinary team to provide straightforward answers to straightforward questions.
What is osteoarthritis? What causes it?
This animation and accompanying leaflet have been developed in conjunction with patients. The resources contain a new explanation about osteoarthritis called Osteoarthritis and You, There Are Things We Can Do.
Nice to watch,
friendly and easy to understand.
The resources are evidence-based, using results from Keel's research study PEP-OA. The research found out what people with osteoarthritis want and need to know to help self-manage their condition. They're also freely available for the public and NHS to download by scanning this QR code and following the link to the keel.health website. John's been involved since the start of the project and even has a starring role in the animation.
At the outset, we decided that the language that most people associate with osteoarthritis is quite tricky to understand. How do we go about making it easy for the public to understand more readily what's going on? So the idea was to gather together all the types of phrases that people associated with osteoarthritis and then have a survey comparing what we thought was a better phraseology to what was already in the public domain.
The patient involvement group have helped us pull it all together. So they've helped us with the storyboard, they've helped us to kind of work out what the images should look like, the tone of the animation. These resources help healthcare professionals to deliver recommended care and clinical guidelines because we know that the provision of good quality information is core treatment for osteoarthritis.
As well as improving information, Keele University is also involved in clinical trials to test and assess different forms of treatment.
We've recently done a trial looking at whether steroid injections are helpful for people with hip osteoarthritis. And it was an important trial to do because at the moment people with hip osteoarthritis are not always offered a steroid injection. And that's not surprising because before our trial there wasn't really any evidence to know whether steroid injections were helpful for people with hip osteoarthritis or not. And the trial showed that people who'd had a steroid injection into their hip joint benefited the most. So that was really important because that's generated new knowledge.
Hello, is it Michelle?
New technology developed at Keele is also helping the NHS tailor consultations for osteoporosis patients.
What we'll do is we're actually going to use the computer just to aid us in this consultation today, if that's all right with you.
Yeah, that's fine.
Improved fracture prevention, or IFRAP, prompts clinicians to ask certain questions, as well as providing access to a range of visual aids. This computerised decision support tool enables clinicians to communicate more effectively with patients, helping to demystify the condition and discuss next steps following diagnosis.
It helps people to talk through their individual risk of fracture and also what treatment options are available. And this IFRAP study contains the decision tool itself, a training package for healthcare professionals and also resources that GPs and patients can use.
Keele also has a dedicated Impact Accelerator unit. This specialist team helps NHS healthcare professionals use the results from research to treat and manage patients in a way that's best for everyone. From consulting room to living room, a range of resources helping patients get answers to their questions about these common conditions.
We hope you enjoyed these reports from Versus Arthritis and Keele University. From the team here at ITN Business, thank you for watching and goodbye.